Magnolia Regional Health Center is a 200-bed hospital in Corinth, Mississippi. We have a service of 16,000, 18,000 people in the city, and there's roughly 40,000 people in Alcorn County. And there's roughly 100 doctors that practice in our community serving our 200-bed hospital. There's almost 1,400 employees here. We are the largest employer in Alcorn County. Prior to working with Presidio, we had a number of technical challenges, one of them being our telephone system. It was antiquated, it would not grow with us.
Their technology really was pretty old. They had a very base phone system providing what we call dial tone in the industry. And then as that system got older, they didn't have the parts to replace that equipment any longer, and they were ready for that next step. They were also looking for a solution that would provide a platform that they could move forward with. More of a crawl, walk, run strategy that would allow them first to address the needs of telephony, then look for an opportunity that they could start integration with their nurse call system, and then look for the opportunity to also integrate physiological alerts and alarms that could go directly to the nurse wherever they were inside the hospital.
Presidio provided us with a unified communication system, and then we chose Unity, their voicemail system, to be part of it. It allowed us to provide the voicemail into a person's email. That's just an amazing thing to have, that you have one place to go and get your messages. By having the phone system, we can show to our patients that we give them more face time. Previous to that, if a nurse should make the phone call to a doctor, they had to kind of wait at the nursing station. So the call light's continuing to go on, and the nurse can't leave the station because she's waiting on a doctor to call. With those mobile phones, they can do that. Having Presidio to help us implement the Cisco phone system, those guys that they brought on site were all engineers. At one point, I think we had 7 Cisco qualified engineers on site. The previous company I'd used, they had 1. One of the things I can say, they do go above and beyond. We had a gentleman from Presidio that night during Go Live. We knew initially that he was going to be doing a lot of wiring in our closet, running the telephone cables to the new VG rack. When he started, he told me it'd be a few hours, but we knew it was a long project. He worked through the entire night. He was not going to leave. And we had a bird's nest. It was just a terrible mess of wires, and this young man, by staying with it all night long, it's a clean, very nice way that he punched everything down. The wires are run very tight, very uniform. He did a great job. I would highly recommend Presidio to any rural hospital because, for one thing, they're reasonable when they come to the price. They have a strong team of people that they bring on site to help you learn about the Cisco call system. They have no problems coming to the rural communities. Many of the guys that we met from Presidio were from small towns, and they had worked in small hospitals, so they were familiar with the challenges that we face. Sometimes we don't have all the resources in our community that we need. Sometimes we don't have the financial resources or the human resources that we need. And those guys understood that.
The work we do at rural hospitals like Magnolia is very satisfying. One of the things that makes Presidio different is our engineering staff. We have a very large, highly certified engineering staff, and they really care about what they do. I think Magnolia is in a much better spot today, mostly because they have a phone system they can now rely on. They were really experiencing a lot of difficulties and downtime with a legacy phone system. And as you can imagine, in a healthcare setting, if the phone's not working and a nurse needs to speak to a physician, that could be life-threatening. So now they have a phone system they can depend on, and they have an opportunity to move forward. As we mentioned before, the opportunity to integrate with their nurse call solution, which will be the next step, and then ultimately look to push those physiological alerts and alarms out to the nurses on the floor.